I've had more people say to me in the last 10 years doing this work that on Friday after we do an immersion, they literally come up to me in tears and say, oh my God, this changed my life.
It's very exciting to drive the change, the positive change that we're looking for in the organization, not based on what people wish to do or what we've always done, but to base it on the evidence behind the best practices in which we should be doing in our organization.
CFO, the CEO, the COO, the C, and everything that starts with a C, they're all positively impacted by this transformative way of doing work.
When you think about the return on the investment, most executives are looking for that big bang.
We do so many things in healthcare that are non-evidence-based, that results in a lot of unnecessary healthcare spending.
The return on the investment really comes from a higher quality of care. And when you talk about staying patient-centric and doing what's best for our patients, not only are you doing what's best for your patients and creating that quality, but in turn you're also having significant cost savings and return on that investment.
Culture eats strategy for breakfast, lunch, and dinner. When you have a critical mass of evidence-based practice mentors, the culture begins to change.
We will be exploring whether or not to bring the immersion to our facility versus sending 1 to 2 people at a time in order to embrace and involve the masses. That may be a better methodology of bringing the immersion to us.
So when we work with organizations and we bring the skill set in and we work with leadership to create the culture and get the resources in place to do it, then evidence-based decision-making becomes normal. That's success. We've seen it happen. It's remarkable.
You must promote evidence-based practice. Improves the patient experience, healthcare quality and safety. It improves population health outcomes. It decreases costs and improves the work life and well-being of clinicians.
But you really can't sustain that energy unless you have it from the top down, and you cultivate that understanding and culture throughout the organization so that those in the staff level understand the importance of this and it becomes your culture.
The best idea is for you to own it and bring it to your patients. You brought it to your patients. You brought it to your clinicians. You brought it to your teams. That's leadership. You brought this amazing thing and made this place amazing.